Good morning. This is Dr. McDaniel at GYN Corner. I'm a board-certified obstetrician gynecologist in New York City, and I'm bringing to you all things health-related for women. Thank you for joining me at the corner today. Let's see, I'm starting a new series. I have a feeling this might be two presentations. Today I decided to speak on a topic that came up in the office last week. I had a patient come in and she literally stated on her intake, it said, "My vagina is numb." So when I saw her, I said, you know what? 29 years and counting, I've never had anyone come in and tell me my vagina is numb. What does that mean? And she had some difficulty articulating it, but basically she said she doesn't seem to feel anything in her vagina. And I said, well, that's the way it's supposed to be, or no one could ever wear tampons because you'd walk around constantly feeling a lump in the vagina, and that's uncomfortable. So I explained to her that anatomically, the upper 2/3 of the vagina do not have sensory fibers, so you're not supposed to feel anything in the vagina on the upper 2/3. Now, we do have stretch fibers, so if you're having a baby, you feel the baby's head start to stretch out the upper vagina. You'll feel the pressure from that because it's stretched out. If you have a tampon sitting there, a tampon's not stretching the vagina out, so you're only going to feel a tampon and it'll feel uncomfortable if the tampon has come down into the lower third of the vaginal vault. We can actually do procedures in the vagina if you have a small tag or a polyp on the upper third of the vagina, or you have a discoloration or a lesion. I don't have to anesthetize the upper 2/3 of the vagina. I don't have to numb it up. I can just grab the polyp or grab the mass or grab the area. As long as I don't pull or push, you're not going to feel any discomfort. If I just lightly grab it and snip it off with scissors or a scalpel, if I can grab it with the polyp, forceps, or single tooth tenaculum or something like that, I can just snip it off, and as long as I'm not pulling or pushing, you're not going to feel anything. You'll only feel discomfort if I push or pull. And if it's in the lower third, I can anesthetize the area in the lower third so that it's numbed up, you don't feel it. But the numbing medicine, the anesthesia, even if it's numb, if I pull or push the tissue, so say I grab it and then I pull the tissue to excise it, you're going to say, oh, that's uncomfortable, or that hurts, because the numbing medicine does not take away the sensation of pulling or pushing. Those are different types of nerves, so you will feel pulling and pushing regardless of anesthesia. But if I just grab it and snip it, you won't feel the pain in the lower thirds of the vagina because it's been numbed up. So I explained that to her, and she said, okay, that makes sense, but that's not what I'm talking about. I'm talking about with sexual activity, I don't feel anything. And I said, okay, that's totally different. And then she said, if the clitoris is rubbed or friction on the clitoris, I'll feel some response from that, but I won't feel it from just the vagina. I said, okay, so that's different, because we know scientifically, and of course I know from working with women for almost 30 years, that the majority of women do not get any kind of sexual stimulation or arousal from just vaginal friction. So vaginal intercourse by itself for most women will not give them enough sensation to cause any kind of arousal response. However, there are nerve bundles, two major nerve bundles for sexual response. Everyone knows that's the clitoris, and the clitoris is the would-be penis, because if we were little boys in utero and the testosterone flared, that clitoris would have formed a penis, a phallus. So the major nerve bundle is the clitoris. The second nerve bundle is the bundle of nerves in that G-spot. And the G-spot is in the upper portion of the vagina, right underneath the bladder. So it's about, well, scientifically it should be about maybe 1.5 inches away from the vaginal opening, in the upper portion of the vaginal wall, right below the bladder, right where the bladder meets the urethra. And that G-spot is a bundle of nerves that, theoretically, with vaginal friction or activity, it should mount a sexual response because of the nerve stimulation there. Unfortunately, for most women, it's too deep in the vagina, so with friction, it doesn't mount much of a sexual or arousal response, but the clitoris is sitting right outside above the vagina, and I guess anatomically, one is supposed to get friction in the vaginal vault from friction of the penis, so that G-spot is supposed to be stimulated, and with the lower body, or the symphysis pubis, where the pubic bone is, that friction is supposed to also activate the clitoral stimulation. So it's supposed to be on two fronts, kind of like World War II, the eastern front and the western front are both supposed to be activated. I don't know why I thought that was funny, but I think that's funny. I love World War II historical stuff. So it's supposed to be lots of activity on the eastern front, which is the G-spot. And I guess if we're doing that analogy, it'd be lots of activity on the western front. That would be the vaginal stimulation from the G-spot. And then the usual activity on the eastern front, which would be the clitoral spot. But unfortunately, all is quiet on the eastern front. So it's the clitoris that gets all of the activity. And that also is pretty common because, as I told her, if you think about it, if you go to a sex shop and you get like sex toys, the sex toys or the dildos always have, they're not just a stick for people to just put in now the vagina and woo, they get their activity. It always has some kind of extra nub or little prongs or things sticking out to also get friction on the clitoris so that you get the stimulation from both. So when she said my vagina is numb, she was referring to the fact that she never seems to get much sensation or sexual arousal response from just vaginal input. So I'm going to stop right there because I'm trying to keep these talks to less than 10 minutes, and I will come back on a part 2 to give the upshot of what I told her in the next presentation. So I hope that was helpful information or enlightenment on why most women have a numb vagina. Thank you for joining me at the corner today. Please check out not just the Facebook page, but the YouTube page, which is also GYN Corner. And we're on all of the podcast platforms, Apple, Google, Spotify, all of them. So check out the podcast because on the podcast and the YouTube, it's easy to just scroll back and see presentations from earlier this year, last year, or even 2019 when I started the social media presentations. We started this in March of 2019. So this is over 2 years now. Thank you for joining me. Have a great rest of your day. Bye.